Imagine sitting down to enjoy meal with your friends when suddenly you feel a sharp burning pain in your stomach that won't go away. This discomfort could be a sign of peptic ulcer. Open sores in the lining of your stomach or small intestine. But what causes these ulcers? Well, it's like having uninvited guests crashing your party. Don't worry though. Understanding what triggers this ulcer and how to deal with them is a key to finding relief and keeping your digestive system happy. So let's take a closer look at peptic ulcer from their symptoms and diagnosis to treatment and prevention, all in simple terms that everyone can understand. Peptic ulcers are open sores that develop on the inner lining of the stomach, upper small intestine, or the esophagus. These ulcers can cause discomfort, pain, and complication if not treated. So in this video, I will tell you everything you should know about peptic ulcer, including the causes, symptoms, diagnosis and treatment and prevention. So what is the cause of this peptic ulcer? The first one is H. pylori. It's a bacteria that commonly causes peptic ulcer. What this bacteria does is that it weakens the protective lining of the stomach and the duodenum, allowing the stomach acid to create the ulcer. So this bacteria weakens the lining of your stomach, then the acid now flushes on those lining that it has destroyed. That is what causes your ulcer pain. Then the next one, always taking of pain medication. The NSAID, long use of NSAID, such as aspirin or ibuprofen, can irritate the stomach lining and increase your risk of developing ulcer. The next one is excessive alcohol consumption, smoking, stress, and anxiety, although they don't directly cause the ulcers, but can worsen the symptoms and delay your healing if you already have one. Cause is gene. Some people may inherit genes that increase their susceptibility to developing peptic ulcer. Then the next one we are discussing is the symptoms. What are the symptoms of peptic ulcer? Burning stomach pain. The most common symptom of peptic ulcer is burning pain in your stomach and often occurring between meals when you are eating or after you have eaten, especially during the night. Then the next symptom is nausea and vomiting. The next one is bloating and feeling full quickly. The next one is always belching. You are belching and you are bloated. Then the next one is dark stool or blood in your stool, vomiting blood, which may indicate a bleeding ulcer. Then the next one I'm going to discuss is the diagnosis. How is this condition diagnosed? How do you know really that you have a peptic ulcer? The first thing they do is an upper GI endoscopy. This is a flexible tube of camera is passed from your throat down to the esophagus and to the stomach and the duodenum for them to detect the type of ulcer that you have. Then the next one is H. pylori testing. It involves blood tests or stool tests that is taken to know whether there is presence of H. pylori in those samples. Then the next one is a barium X-ray. A shocking liquid containing barium is given to you for you to swallow, and this coats the esophagus, the stomach, and the duodenum, making it visible for X-ray. So they will now pinpoint where the ulcer is exactly. So treatment, how do you treat this peptic ulcer? If H. pylori infection is present, a combination of antibiotics such as amoxicillin, clarithromycin, metronidazole is prescribed to eradicate this bacteria. Then the next drug that will be given to you is the PPIs. These medications reduce stomach acid production, allowing ulcers to heal. Example of this drug is omeprazole, pantoprazole, ranitidine, and famotidine. Then the next one is antacids. Over-the-counter antacids provide temporal relief by neutralizing the stomach acid. Example of them is Gestid for those in Nigeria. The next treatment is use of cytoprotective agents. Medications like sucralfates form a protective barrier over ulcers and promote your healing. The next thing you should do is lifestyle modification, like avoiding pain medications that are classified as NSAID, alcohol, and smoking. So if you do these things, it can prevent the ulcer from recurring and promote your healing. Then the next thing we are going to discuss is complications. If you don't treat your ulcers, it can lead to bleeding ulcers. Ulcers can erode your blood vessels. That is why it away, leading to internal bleeding, and potentially this is very life-threatening. The next one is perforation. In severe cases, ulcers can penetrate the wall of your stomach or your intestine, causing the leakage of your stomach content to be pouring into the abdominal cavity, and you know what that means. Then obstruction. Scar tissues from the healed ulcers may narrow the digestive tract, causing blockage that impair food passage. How do I prevent myself from coming down with ulcers if I don't? What you should do, the first thing you should do is treat H. pylori infection as quickly as possible. Limit the use of these pain medications classified as NSAID, such as ibuprofen, and use it when your medical doctor advises you to do so. Avoid excessive alcohol consumption and smoking. Manage your stress through relaxation techniques, do exercise, and go for counseling if you are extremely stressed. Relieve yourself from everything or activity that are stressing you for you to get your health back. Follow a healthy diet rich in fruits and vegetables, whole grains. This can help to reduce the acidity of the stomach. Peptic ulcers can significantly impact your quality of life if not properly managed. So early detection, appropriate treatment, and lifestyle modifications can essential for the effective management and prevention of the complications. So if you experience any persistent stomach pain and other symptoms suggestive to peptic ulcer, it is good that you consult your doctor for professional evaluation and treatment.